the 27th of February 2020 began like every other random day for me. I was sitting quietly in a meeting somewhere when I received a WhatsApp message. We have confirmed our first case of COVID-19. Little did I know at that time that that simple WhatsApp message was going to be my baptism of fire into what I now refer to as my first pandemic response experience. The last couple of months have been a lot of things for me, my colleagues, and indeed a lot of Nigerians. The sleepless nights, the confusion, the frustration, the joy from having our loved ones return from COVID isolation centers, the sadness from losing loved ones to COVID-19, the on and off depression, the sleepless nights, the endless meetings, the anxiety, a lot of things. But the biggest parts for me would always be the lessons from this experience. So I call this the 4 biggest lessons we should all learn about public health from the COVID-19 pandemic. First lesson, public health is political. In public health, we often say that the field is driven by science and evidence, and this is true. Nobody can argue that. But is that really all that drives this very important field? I think not. And for those of us who have either been involved in this pandemic response or who have followed the trajectory of conversations, would probably by now understand the extent to which politics and political decisions drive public health interventions, public health response, public health infrastructure. Whether you're talking about the leadership itself, whether you're talking about the financing of public health initiatives or response. Whatever it is, politics is a big driver of whatever happens as far as public health response is concerned. Early on in Nigeria, we saw the president inaugurate the Presidential Task Force on COVID-19 to provide both political and strategic leadership for the response. Many of us who are involved in this response can argue positively that a large part of the success that we have had in the country to the COVID response has been largely to this political structure that was put in place early enough. At the micro level, we've seen governors exercise their political will to ensure that necessary infrastructure is available in their states. Whether you're talking about laboratories to diagnose COVID-19, whether you're talking about COVID isolation centers for clinical management, one way or the other, leaderships at the state level have taken some responsibility, exercising their political will to ensure that things happen when they should, how they should, and for who they should. So, we must begin to ask public health experts, or generally as a whole, begin to internalize and reflect on the role that politics plays in shaping public health response if we must build back better post-COVID-19. The second lesson is that public health is local. Local here, not necessarily restricting or limiting to geographical settings, even though that still applies, but local in the sense that we unpack the bigger population into smaller groups with similar characteristics such as age, gender, religion, profession. Because at the end of the day, messages, even though they are the same, would always be interpreted by people based on their circumstances at the time and the environment that they find themselves in. So the way a doctor would interpret the same message might be different from the way a farmer working in his farms will interpret it. The way a rich man might interpret a message might be a bit different from the way that a poor man, a homeless person, would interpret the same messaging. So if we are to communicate better in future, we need to start to learn to customize public health messaging, public health interventions to fit different groups of people in their settings, within their spaces. So that at the end of the day, we do not end up leaving any group behind. The third lesson is that public health is everything, not just health. Due to the COVID pandemic, we have seen millions of jobs lost. Millions of people have lost their sources of livelihoods due to the multiple global lockdowns. Businesses have gone bankrupt. Many have been shut down. Some may rebuild, some may not. In the early days of the pandemic in Nigeria, we had the Vice President of Nigeria, Professor Yemi Osinbajo, project that by December 2020, close to 39.4 million jobs will be lost in Nigeria. If that number does not jar you, think for a minute about how many Aishas and Hameds, how many Ngozis and Emekas, how many Tolus and Okpers, how many Celestinas is 39.4 million. How many of that 39.4 million are our mothers, our brothers, our sisters, our uncles, our friends, our neighbors? Think about the almost 50 million school children who have been forced to stay at home for almost 6 months because our schools and our institutions are locked down. Think about all of this within a context of a country where even before the lockdown, unemployment rate was already at almost 34%. And even among those who were employed, the underemployment was at about 19%, according to the Nigerian Bureau of Statistics. In a context where a huge number of our children were already out of school. In a context where our educational infrastructure was already as fragile as we had it pre-COVID. Think about it for a minute. Finally, public health is everybody's business. For the first time in a very long time, because of the COVID pandemic, we have a situation where everybody is affected by the same thing. In this case, COVID-19 infection. For the very first time in a long time, a lot of us are living through a situation where it doesn't matter who you are, whether you're rich or poor, whether you're a farmer, a doctor, whether you're a journalist, a politician, whether you're young or old, whether you're a boy or a girl, male or female, Nobody is immune. Nobody is shielded. We've had presidents affected. We've had governors affected. We've had farmers. We've had doctors. Everybody, everywhere. Even in places where we thought things were a lot better, even in more developed climes, developed nations and underdeveloped nations alike, everybody is affected. Nobody is immune, nobody is shielded. So if this does not make us think about how much anything public health is everybody's business, I don't know what else will. And as I end this talk today, I want to invite all of us, each one of us, to sit back and think for a minute about the role that we are playing to end this pandemic. Are you making things better, or are you making them worse? Thank you.